Let's talk about combination therapy. When would you consider combination therapy using a rituximab plus a purine analog? You have worked on this in the past for the last over 10 years.
The rituximab is a humanized monoclonal antibody targeting CD20, and hairy cell leukemia cells do have the highest expression of CD20 among various lymphoid malignancies. And rituximab is now commonly used in various lymphoid neoplasms, including lymphomas and lymphoid leukemias. And it was evaluated in a particularly relapse setting as a single agent in hairy cell leukemia in early 2000s. And there were a few studies that showed that the drug, even as a single agent, is active in this disease and can produce responses, including occasionally complete responses. So it clearly makes sense to use rituximab in hairy cell. Now, I would like to also add that in many lymphoid leukemias and lymphomas, the single agent activity of rituximab is almost minimal, but the addition of rituximab to the chemotherapy regimen that's used for that specific lymphoma or lymphoid malignancy does improve outcomes significantly, and this is what has led to the approval of rituximab for various lymphomas and lymphoid leukemias. Now, because of this, we decided, as you mentioned many years ago, to combine these two drugs, and that's rituximab and cladribine. And we first decided not to do this concurrently, mainly because we felt that cladribine per se on its own can produce very high responses, and in a significant proportion of patients this would be highly durable. So we felt that we did not want to have any form of complications, and because of this we did sequential therapy, and we gave cladribine, and this was followed by 8 weekly doses of rituximab. And with that, we have seen and reported that the response rate, a complete morphological response rate, is essentially 100%. And with the long follow-up of these patients, we have had almost no relapses, which clearly is exciting, but it's also somewhat predictable in my opinion, because, for example, in a similar disease, chronic lymphocytic leukemia, when rituximab is added to nucleoside analogs, it produces improvement in responses and duration of responses. Now, obviously, the question comes, is concomitant administration of rituximab is better than sequential? And that means that starting the rituximab while or close to the time you have given the nucleoside analog. The British group published a few years ago in patients who had relapsed hairy cell, the concomitant approach in a case series of patients, and they showed a very remarkable response rate.